welcome back to my channel. Everkum ende channelilekku swagatham. So I have started up a session for Prometric exam. Actually, I have discussed many of the MCQs which is very helpful for GCC licensing exam, and many of them have qualified DHA, means Dubai as well as Qatar Prometric. Many exams, many of them have qualified. Now I have started up a sessions for MCQs, which I have received the questions which I have received from the question bank of previous exams. So if you are following me or watching my MCQs in YouTube, it will be more helpful for all the professionals to qualify the GCC exam. So patiently watch this video. I have started up the first session before. This is a continuation of the first session. Likewise, I will be continuing the sessions in all Sundays. So you can even join my application also. The question bank is shared with a minimal price in my app also. So you can download or you can purchase it. So patiently. Let us begin today's session, that is part 2 session for Prometric. Moving on to the 13th question. X-ray view of choice for lumbar spondylosis is option A, PAV view, that is posterior view. Option B, lateral view. Option C, left oblique view. And option D, right oblique view. So the right choice of X-ray for lumbar spondylosis, the answer is option B, lateral view. Moving on to the next question, question number 14. High resolution CT, that is HRCT of the lung, is a specialized CT technique for greater detail of lung parenchyma, and it utilizes. So HRCT is usually for lung. So the options are option A, special lung filters. Option B, thick collimation. Option C, bone algorithm for image reconstruction. And option D, large field of view. The apt answer is option C, bone algorithm for image reconstruction. For HRCT, the thickness is 1 mm. Moving on to the next question, question number 15. What modification is needed for proper radiographic image in a heavy build, bony build person? Option A, increased MA. MA means tube current. Option B, increased KVP. That is KVP means kilovolt peak. Option C, increased exposure time. And option D, increased developing time. So what modification have to be given for a heavy bony build person when compared with a slim person? The apt answer is option B, increased KVP. So MA corresponds to the tube current, that is the quality of the X-ray beam determines the KVP, and quantity of the X-ray beam determines the MA. So KVP determines the penetrating power of the X-ray beam. So when a heavy bony build person comes, we have to increase the KVP in order to acquire a good quality image. Moving on to the next question, question number 16. Maximum radiation exposure occurs in option A, bone scan, option B, X-ray, option C, MRI, and option D, CT. Along with these options, the answer is option D, CT scan. Compared with the above options, in MRI, as you all know, there is no radiation. X-ray and bone scan. Comparing other imaging modalities, CT is having the maximum radiation exposure. Moving on to the question number 17. USG is definite investigation of option A, Watsup. Watsup is a rare pregnancy complication where the fetus is losing the blood. Option B, obstruction placenta. Placenta have any obstruction. Then comes the third one, placenta previa. Placenta previa means whether the placenta is coming out and closing the cervix of mother. It relates with the how whether the pregnancy is normal or moved for cesarean.
Option D is imperforate hymen. Imperforate hymen means a membrane is coming out and closing the vagina. That's the condition. So here the according to the options, USG is a definite investigation of. Answer is placenta previa. So after determining whether the placenta is coming out or not, depending on that, the doctors will determine whether the pregnancies can be normal or to move ahead with cesarean. Moving on to the next question, question number 18. Investigation of choice in whole body imaging in metastasis is. Metastasis is a condition where when a patient is having any cancer, there is a chance for metastasis. Metastasis means spread. So, for a whole body imaging, which is the investigation of choice? Option A, magnetic resonance imaging. Option B, angiography. Option C, venography. And option D, CT scan. So, the bony imaging, MRI is not good for bony imaging. Angio-veno is all related with blood vessels. So the best choice is CT scan to determine the whole body imaging for metastasis. So the answer is option D, CT scan. Moving on to the next question, question number 19. Gyromagnetic property of proton is seen in option A, MRI, option C, CT, option B, CT, option C, PET, and option D, USG. As you all know, in CT, the mode of beam is X-ray. In PET, we are using, it is in nuclear medicine, radioactive isotope is injecting. USG, we are using sound waves. So the the proton is related with MRI. So the answer is option A, MRI. Moving on to the next question, question number 20. Most reliable test for spinal tuberculosis. Option A, raised ESR, means erythrocyte sedimentation rate. Option B, PPD skin test, means PPD means purified protein derivative skin test. Option C, CT guided biopsy. And option D, MRI. So the relevant test for spinal tuberculosis is CT guided biopsy. Moving on to the next question, question number 21. In magnetic resonance imaging, paramagnetic substance scores. Gadolinium is a paramagnetic substance that we are giving as contrast in MRI. Option A, shortening of both T1 and T2 relaxation times. Option B, shortening of T2 relaxation time only. Option C, shortening of T1 relaxation time only. And option D, no effect on T1 or T2 relaxation time. So the paramagnetic substance cause shortening of both T1 and T2 relaxation time. So it is the answer. Answer is A, shortening of both T1 and T2 relaxation times. Moving on to the next question, question number 22. SI unit of absorbed dose of radiation is. So the unit for absorbed dose. Option A, Roentgen. Option B, Gray. Option C, Sievert. Option D is Coulomb. So Roentgen is all related with exposure. The SI unit of absorbed dose is, the answer is option B, Gray. That is, we are giving this much Gray, 45 Gray in 20 fraction or 40 Gray in 20 fraction with a daily fraction of 2 Gray we are giving as radiation in the case of cancer patients. So with that, I'm winding up today's session. Hope today's session is more clear. Again, also we will be discussing the MCQs of Prometric MCQs. The questions which have been collected from the question bank. I'll be uploading videos only on Sunday, so stay tuned on next Sunday for the more and more MCQs. If you Please share with your friends if you like my class.